Hello everyone, my name is Blake Morrow. I'm a nurse with the Cardiac Rehab Department here at Atrium Health Cabarrus in Concord. So today for your weekly educational topic, we're going to go over coronary artery anatomy. So let's go ahead and get started. So first up, we're just going to go over what coronary arteries are. So by definition, coronary arteries are blood vessels that supply oxygen-rich blood to the heart muscle. So these arteries will wrap around the entirety of the heart muscle and then end up breaking off into smaller branches that dive into the heart muscle to help bring it blood. So next up are the different coronary arteries that we do have. So there are two main coronary arteries, the left main coronary artery and the right coronary artery. The left main coronary artery, otherwise known as the LMCA, this artery supplies blood to the left side of the heart muscle, given the name left main coronary artery. And this main coronary artery divides into different arteries, which are called the left anterior descending artery and the circumflex artery. So in regards to those arteries, the first one we're going to go over is the left anterior descending. And this is the largest artery in or on your heart muscle, and it's deemed the widowmaker. I'm not sure if you guys have ever heard of that before, but with it being the largest coronary artery, if there is damage or a heart attack does hit this certain artery, it can cause a lot of damage and even death. It's a very high mortality if you don't get treated, as soon as possible. So that's where we got that name, the widowmaker. So the LAD, the left anterior descending artery, it supplies blood to the front left side of the heart. And then for the circumflex artery, this artery circles the heart muscle, so given the name circumflex, and it supplies blood to the outer side and the back of the heart. So that is the left side of the coronary artery. So the right side is made up of the right coronary artery. This artery supplies blood to the right side of the heart, which includes the SA and the AV nodes. So SA stands for sinoatrial, and AV stands for atrioventricular. So these nodes regulate the heart's rhythm. So something that your cardiologist can see is if you're presenting with a heart attack or some sort of coronary artery disease, if the right coronary artery is affected, then you might have some changes in your heart's rhythm. You might present with some sort of irregularity that you might not have been diagnosed with before. That's something that can point to them, in the right direction of maybe this person's having a heart attack and it's affecting that right coronary artery. So the right coronary artery divides into smaller branches, which include the right posterior descending artery and the acute marginal artery. So the smaller branches of the coronary arteries that we're not really going to go over in detail are the obtuse marginal, septal perforator, and the diagonals. So next up, we're going to go over what happens to your coronary arteries when a heart attack does occur. So by definition, a heart attack is caused by a sudden blockage of one of the coronary arteries. And we're going to go over three types of heart attacks today. So first up is a STEMI, excuse me, and that stands for ST elevated myocardial infarction, excuse me, and that's classified as a major heart attack. So this type of heart attack occurs when one of the major coronary arteries gets completely blocked, 100% blocked. And this is considered a medical, emergency, a very serious issue, and can cause significant damage or death if it's not treated immediately. And then STEMI, with the ST elevation, that is just something that occurs on your EKG when you present to the hospital. It's something that the cardiologist can see, and it's just a sign to show that you are having a major heart attack. So next up is a non-STEMI. So that stands for non-ST elevated myocardial infarction, and it occurs when one of the coronary arteries is only partially blocked. And there's less damage, and it's considered a minor heart attack, but it's definitely still a serious issue and still needs to be treated, as soon as possible. Lastly, we're going to go over a coronary artery spasm. So that occurs when there's no blockage that occurs within the heart caused by cholesterol or anything like that. But it's caused by when one of the coronary arteries tightens so much to where it can drastically reduce the blood flow from that coronary artery or stop it completely. And there's no permanent damage or anything that occurs during this coronary artery spasm, but it does increase your risk of another heart attack that may be more serious, like a STEMI or an NSTEMI in the future. So this picture is just a visual. This is actually a cath report after somebody's presented with a ST elevated myocardial infarction and had a stent placed. So as you can see in the very middle, so this is a picture of that patient's coronary anatomy. So all of their blood vessels that are around their heart. And the one that's running right down the middle is the LAD, so the widowmaker. So this patient actually had a 100% blockage within their LAD, so they had to place a stent, and as you can see in that little box at the top, the blockage went from 100% to 0%. So that stent was successful, and hopefully this patient is still with us and is doing a lot better than they were before the stent was placed. And then next up is a visual of a non-STEMI, and there's a lot going on in this picture, but we're still just going to focus on the LAD, so that major vessel that's going down right in the middle of the picture. So you can see in the little box, kind of like the last picture, this wasn't 100% blocked, but it was 95% blocked. So the stent was placed, and then so the blockage went from 95% to 0%. So again, the blockage was treated successfully with that stent, and then again, hopefully this patient made a full recovery. So next up, we're going to talk about CABG, or coronary artery bypass grafting. So I'm sure some of you within the program have had CABGs before. So a CABG, it's a procedure that's necessary when you have multiple blockages within your coronary arteries. So during a CABG procedure, what it consists of is the surgery team will take a healthy artery or a vein that's harvested from another part of your body, most commonly from your legs or another part of your chest, or anywhere that they can find a viable artery. And then they'll take that healthy vessel and connect it to the blocked artery, the artery that has that blockage in it that's not getting the adequate amount of blood and oxygen through it. So once that vessel is connected, the vessel will bypass the blocked portion of the artery, and then that creates a new passage which allows blood and oxygen to get from that blocked artery, or bypass over that blocked artery to keep supplying your heart muscle with that blood that it wasn't getting before with that blocked artery. And then on the right here, I've just got a little visualization for you, so you can see on the right that internal mammary artery graft that was taken from the chest wall. So they took that vessel and bypassed the blockage in the coronary artery, and then that artery graft is stitched to the coronary artery, which allows that blood to bypass that blockage and to allow your blood to get the oxygen and blood that it needs. So next up, we're just going to talk about what happens with your coronary arteries during heart failure. So if coronary arteries are partially blocked for an extended amount of time, if you don't get treatment, in the adequate amount of time that you need to, or if your heart is damaged during a heart attack, the heart may become too weak. The heart may become too weak to pump enough blood to meet the body's needs. So this condition is known as heart failure. There's two different types of heart failure. There's systolic heart failure versus diastolic heart failure. So systolic heart failure is also known as heart failure with reduced ejection fraction. And then in systolic heart failure, the left ventricle, which is one of the chambers of your heart, it loses its ability to contract normally. So the heart can't pump with enough force to push enough blood into circulation. And then for diastolic heart failure, which is known as heart failure with preserved ejection fraction, the left ventricle loses its ability to relax. So the muscle becomes stiff. So comparison to systolic heart failure, to where the ventricle can't contract normally, in diastolic heart failure, the ventricle cannot relax normally because the muscle becomes stiff. And then when this happens, the heart can't properly fill with blood during the resting period between each beat. And then next, we're going to go over just different types of heart valve surgery. So heart valve surgery may be needed to treat a heart valve disease. So if one of your heart valves is calcified, if it's too stiff, it's not allowing blood to get through it, or if it's just a faulty valve, it's not working anymore. And it can include any of your heart valves. So heart valves keep the blood flowing in the correct direction through your heart, and these 4 heart valves include mitral valve, tricuspid, pulmonary, and aortic. So I've got 3 examples of heart valve surgeries or procedures that we do within the hospital, and I'm sure some of you might have actually gone through this personally. So first one we're going to go over is actually one of the newer things that we're doing here at Atrium Health Cabarrus. It's called a TAVR. Excuse me. It's called a transcatheter aortic valve replacement. The definition is a minimally invasive heart procedure to replace a narrowed aortic valve that fails to open properly. And this procedure may be an option if the patient's at a high risk for surgery, so age or other comorbidities or anything that's would give that patient a higher risk for surgery or for good outcomes for the surgery, and they might consider doing a TAVR procedure on that patient. And we're going to go ahead and skip mitral valve since we already just went through TAVR. So we'll go ahead and just go over aortic valve replacement. So this is essentially the same concept of a TAVR, but it's just through surgery. So it's used to treat aortic stenosis or regurgitation, like I mentioned earlier. In comparison to the TAVR, they actually go in, it is open heart surgery. So they replace that aortic valve with a synthetic or an animal valve. And then mitral valve replacement is essentially the same sort of surgery, but they're just replacing the mitral valve instead of the aortic valve. So it honestly just depends on, what valve is faulty and which one they have to replace. The concept of the surgeries is pretty similar. And then lastly, we're just going to go over how cardiac rehab helps your coronary artery anatomy. So essentially, the goal of cardiac rehab is to establish an individualized plan to help you regain strength, prevent your condition from worsening, reduce your risk of future heart problems, and improve your health and quality of life. So unfortunately, when it does come to heart disease and things of this nature that you've been through, there is a higher likelihood of these things happening again if we don't stay on top of your heart health as much as possible. So that's the last thing we want to happen. We want to keep you healthy, keep you out of the hospital. So we really want to help you, reach your goals and get your heart muscle as strong as we can through that exercise and things of that nature. So through the exercise provided with us through cardiac rehab, you will strengthen your heart muscle. You will stop or possibly even reverse the damage to your blood vessels that have occurred through, those heart attacks, coronary artery disease, things of that nature. And then through the education, which is, just as important, if not more important than the exercise. That's how you're going to properly learn to modify your lifestyle, help with your diet habits, help with your stress management, decrease your cholesterol levels, just try to reverse any, risk factors that you do have that could increase your risk for reoccurring heart issues. We really want to help you, combat those things and just get you as healthy as we can. So that's going to conclude our educational session on coronary anatomy. Here are just some links that I've used to gather some of this information. So if you do have any questions, feel free to reach out to your coordinator. If not, we'll see you next time.